Dr. Francis. We've been talking a lot about heart disease, and what would be some of your recommendations for helping prevent heart disease?
I think the number one is for people who smoke to quit smoking. But a lot of my patients don't smoke, and so really the second most important thing is probably our lifestyle choices, basically diet and exercise.
Definitely true. And I know that heart disease is actually one of the top killers in the United States. Tell me why you think that is.
I think part of the reason is because our patients are living longer, but we're also seeing some more premature heart disease that we haven't seen before. And a lot of that is because there's obesity even in our young children and adolescents.
Definitely true. I was reading somewhere that 66% of Americans are obese, and that has a lot to do with diet, right? Of course.
Yeah, absolutely.
What would you recommend for preventing some of these heart disease?
Well, I sort of love the basic things that people talk about. Shopping the perimeter, avoiding the sort of the processed foods, the boxed foods, things like that.
So diet, definitely. Also blood pressure, there's other things to watch for. Do medications have any factor in helping decrease some of this heart disease?
Yeah, medicines are great to prevent heart disease. I think one thing we forget about, though, are those basic things. People come to see me because they've probably tried those things before. They've been trying exercise, they've been trying diet. So a lot of times we do need medicine.
So how young do you see patients that maybe you could have seen beforehand and prevented some of this? You were saying something, maybe children, seeing children and noticing and educating them. What would be your recommendation for that?
Yeah, well, I practice in internal medicine, and I don't see patients younger than 18.
Exactly.
But I think the tragedy is when someone comes in and they're 35 or 40 years old, and they're just thinking that they ought to take some time to take care of themselves. They think, well, I want to start exercising, I want to start dieting, what can I do? And I just wish we would start earlier. So
what do you recommend to them? Usually with diet and exercise, what is usually a program that you would set someone with maybe early detections of heart disease?
Yeah, that's a great question. I spend a lot of time doing education with my patients with diabetes, and a minimum I have them do 30 minutes a day of walking. Usually start 5 minutes a day, increase a minute per week, something like that. A strategy a lot of people like to do is get a pedometer. Mm-hmm. Then you can kind of track your steps. There's that 10,000 step per day program around there. I think a lot of us feel like we have an active lifestyle, but we don't realize that we have remote controls, we have cars, we have scooters, we have things that make it really easy for us to get around, and we're just not as active as we used to be.
I think you're right about that. We have a lot of conveniences that have caused us to become maybe lazy. Would you agree with that?
I think so.
And maybe our foods even have caused us to be a little bit more lazy in preparing them. Like, what would be some of your suggestions with food and keeping that more simplistic for people that may have obesity? They might be a little overweight. What would your suggestions be of that?
One idea is what we call mindless eating.
Mm-hmm. Yeah, I do that. Do you do that?
Well, we put a lot of pressure on people to count their calories and look at everything, but there's some food psychologists out there that would suggest that people, the more they think about it, the more they get frustrated, the more they eat. So a simple thing to do might be to empty your cupboards of big plates and just have really small plates and small serving sizes, things like that.
And what are some of the foods that you recommend for heart healthy diets?
There's the DASH diet that talks about low salt, low saturated fats, things like that. We have dietitians that can go through that with the patients. I don't do a lot of specific dietary counseling. A lot of people have different, likes and dislikes. Most patients can recognize really where they could improve. Maybe they drink a lot of soda pop, for example, or things that would contribute sort of free calories they don't need. A little too much nutrition.
Definitely something to think about. Tell me where you're located at, and I know you're at the Budge Clinic, but where exactly?
Yeah, we're in Logan, just next to the Logan Regional Hospital, 14th North, and we're on the 3rd floor of the Budge Clinic.
Well, I appreciate you so much, Dr. Francis, telling us about different ways to help prevent heart disease. Thank you so much.
My pleasure.